pressure management and what that means for pelvic organ prolapse. Hi, my name is Dr. Kaylee Simmerman, pelvic floor physical therapist, owner and founder of the Hope Doctors Pelvic Floor Physical Therapy here in St. Petersburg, and launching into globally. Super excited about that. But I wanted to talk today about pressure management. My glasses are fogging because it's actually very, very humid out here. But I wanted to talk about pressure management and what that means for you if you have pelvic organ prolapse or just in general. So when we say something like pressure management, you see that floating around here on YouTube, you see it on social media. Everyone's like, you got to work on your pressure, you got to work on all of that to make it better. And what that means is I like to think of it kind of like a can of soup. The top is going to be here like your throat diaphragm or your throat, your glottis, this kind of area. Second part's going to be kind of the abdomen, the diaphragm, and then the third part's going to be your pelvic floor. So the bottom is the pelvic floor, the top is kind of your throat and your upper body, right? If you have no control, no coordination in the bottom, when you cough, laugh, sneeze, something like that, everything's going to go down because it's going to follow the path of least resistance, right? And that's usually what happens is the pelvic floor, because it doesn't have a lot of like focus. So we don't focus on it. We don't train it. We're not told to do that from a young age. We often forget about it and it gets the path of least resistance. So that's why it starts to leak. It can't maintain the pressure down. That's why prolapse gets so heavy at the end of the day. Because after a long period of time, lots of lifting, lots of carrying kids, those kinds of things, it eventually is just going to be really tired and it's going to give because, again, it doesn't have any resistance to prevent that from happening. And so it's really important that you understand that concept, because if we need to work on the pelvic floor to prevent pressure from going down, we have to work on getting that pressure. Sorry, there's like a gnat or a mosquito flying around me. We have to work on that pressure going into the different areas of the body. And so what we mean by that is if the canister or the down part is the part that's the weak or the least resistance, right? Doesn't mean you need to strengthen it. That's always the first thought. It actually means how can we send pressure to other places before it gets to the pelvic floor? For example, landing mechanics. If your feet are really rigid or your feet are landing on the ground with jumping or running and you're leaking and your feet are getting a lot of that pressure, but they don't have good mobility, they're not going to absorb what the ground is sending it as far as shock. And so that will go all the way up the chain, into the pelvic floor. And the pelvic floor is now going to get it from the bottom up, which is also going to cause an issue. So we would want to work on the feet, right? Pressure management, again, if we work on the feet, we decrease the mobility or the limitations of mobility to where when you land, the arches can drop, they can move, they absorb that energy well. The knees are in good support. They're strong enough to stay above the ankles, and the hips are also in a really good position because they're strong and stable. The pelvic floor is not going to take extra absorption. Therefore, you're not going to have the leakage and the heaviness and the pressure and the symptoms, right? Same thing if you think about going up. We want to look at the rib cage. So for example, if you're getting leakage or you're getting pelvic organ prolapse symptoms in the pelvic floor, we want to see what's going on with the rib cage. Are you getting expansion to the sides? Are you getting expansion to the front and the back? If not, if we work on that, if we expand how much breath goes into the rib cage and those ribs open to the side and they open to the front and they open to the back, the pressure from the pelvic floor, from the jumping, the landing, those kinds of things, you can actually send it up. When you cough, when you sneeze, you can train to send that pressure from the abdomen up into the rib cage, and now it has more room to go up and add pressure there instead of pressure in the pelvic floor. Same with the shoulders and the mid-back. Again, like if you improve mobility, improve space, and open up space in the rib cage, open up space in the feet, you're going to have a lot less likelihood that that pressure has to go to the path of least resistance or the pelvic floor. It will be able to travel throughout the body before it goes to the pelvic floor. I've seen this in action with my athletes, with the people that cough and laugh and have pelvic prolapse symptoms, or they're walking for long periods of time. So they'll walk for long periods of time with a baby carrier. They start to get symptoms, take the baby out. They take some breaths into the rib cage. They move their feet around. They do some heel raises, a few of the movements we learn in clinic, and then their symptoms go away. Put baby back in carrier, move on again. So again, it's like it's a piece of management. That's why it's called pressure management. We're teaching your body how to manage that pressure, the things that are going through the system. We also want to think about like core engagement and pelvic floor stability. When we're coughing, laughing, sneezing, are we able to engage the core enough? Not necessarily zipping up as much as you can, but can we maintain the pressure inside so it doesn't have to go down? Are we strong enough to have good core, good back, good side body control that that pressure can go up or down without causing a symptom? And if so, then you're not going to have those same issues. Hey, buddy. So be mindful of that as well, that the core engagement is really important. Your pelvic floor is more like a trampoline than just a muscle that needs to contract, relax. We have to train it to be able to lengthen with pressure when we're adding pressure, and we have to train it to be able to contract when we need to. It's really important that it lengthens and it activates or contracts. It has to be able to kind of rebound like a trampoline, right? Like it has to be able to take the pressure and then move it, take the pressure and then move it, take the pressure and then move it, not just squeeze and hold and not do anything at all. That's why we don't practice Kegels only. It's important to go through the whole body, and it's important to go through all of that as training. Again, pressure management depends on your body, where your body is not accepting pressure well and what you need to work on. That's what your pelvic therapist should be looking at. If you're going into a clinic and the pelvic therapist is only, this goes back to like questions that we asked last time, but if they're only looking at your pelvic floor, they're not watching your pelvic floor when you're coughing, they're not watching your pelvic floor when you're holding something or when you're lifting or you're doing whatever it is that causes the symptom, they're going to totally miss the point. Are they looking at the rib cage? Are they looking at the feet? Are they paying attention to what happens when you're landing? It's very important that you find someone that can do that. Pressure management is huge. Be sure you read my description. I am launching something super exciting for those of us with pelvic organ prolapse, and there's a wait list open now. It's going to be amazing, something that's never before been done. I've never seen it out there before, so I'm pumped for those of you to join. We're going to have a whole week of just pressure management and education on that, and tips and tricks and how to make your own program for it. So definitely sign up for that. Subscribe to our YouTube channel. Help us reach many. Our whole goal here is to be able to share this information with the world. I love to teach. I love to educate. It's actually something I'm stepping more into, and I'm really excited about that. Let's not block mommy totally, okay? Super excited about it. But anyways, I hope you guys have a great day. Pressure management, again, that's the quickest way to explain that, the quickest way to give you that information. If you have questions, remember, you can always ask, and I would love to answer them. I will also drop my personal email there in case you have specific ones. I hope you have a fantastic day.